Causative factors: allergies and congestion in the nasal pathway. Physical conditions like deviated nasal septum or deformed anatomical conditions related to airways. Obesity, certain medications such as antidepressants. Habits like alcoholism, excessive smoking. Conditions like tonsils. Sleep posture, diseases such as sleep apnea. Severe stress and related emotional factors, genetic causes. Home remedies. For moderate and acute cases, some home remedial approaches are helpful. Severe cases may need the advice of physician. Foods. In some people, some foods or certain combination of foods can cause the problem. One has to avoid these. A few such examples are: a late night heavy dinner could trigger a temporary snoring. Such heavy meal will be more problematic with people suffering from snoring issues. Certain foods for which one is allergic may trigger snoring. In some cases, certain combination of foods and the timing could be a causative factor. For example, if a person mixes curd and milk in dinner along with rice, could cause an event. While this combination may not cause an issue in lunch, similarly, a heavy spiced dinner could be a culprit while may not be a cause of concern in lunch. Late night ice creams, desserts could trigger a problem due to respiratory pathway constriction. Junk foods, excessive oil-charred foods, many processed foods, excessive sugary drinks could also contribute to the problem. Sleep and posture. Posture helps in minimizing or even alleviating the problem, at least temporarily. Sleeping flat on one's back causes snoring to occur most often. While on your back, your tongue is most likely to fall back, causing your airway to narrow or close completely. Elevating your upper body from the waist up is another helpful position to stop snoring. This can be achieved by a couple of pillows or adjustable bed. Stress can elevate or aggravate the problem. Try to sleep coolly. Keep away the stress factor at least just before sleep. Thanks for watching. Please do subscribe our channel.